One of the things that I found about nursing and healthcare was that the role of the nurse is so essential to helping the patient with the need and the doctor with the plan get it to work. And it's the nurse that really does make it happen. It's not just a great job, it's a wonderful profession. It's a wonderful opportunity. I don't give nearly as much as I get back from it. I love doing things and looking after people and making a difference and trying to help make it better.
During the time that we had CCU, we had the unit open 24/7, 365 days a year with about 8 people. And during that time, Gail was a mentor to a lot of us. She encouraged nurses to do a good job. She wanted you to be the very best that you could be.
I have seen her take patients warm blankets. I've seen her hold their hand. I've seen her question orders. I've seen her talk to doctors about the patient's care. She is just a detail-oriented nurse when it comes to patient care.
When we would have snow days and we would all get our go bags and people would come pick us up and come in, we would come into the hospital to work. We never knew when we were going back home. Gail would be right there with us with her lab coat on and her street clothes, working right along with the rest of us. And she didn't go home until the rest of us had been able to go home.
She's an extraordinary woman. She can do so many different things, and she has been here for over 50 years, and there's not too many people that can say that they've accomplished that. So I think she is remarkable in the things that she's accomplished in her lifetime.
As a volunteer, when I have to have a TB test, as do all volunteers every year, and so we have to go over to a certain building to get the TB test. Gail is there at 7 o'clock in the morning giving TB tests. Now you would think, working 50 years plus at a hospital, that she would sleep in a little bit later, but not Gail. She is always there. I mean,
Gail really has had an exponential influence on the nursing organization. She has brought on 6 of our nurse leaders who are still here. And for every one of those nurse leaders, I'm sure that there's probably another 5 or 6 nurses that still work here because of Gail's leadership.
if I had to describe Gail in one word, I would say loyal. She was loyal to her family. She was loyal to her work. Any of the other nurses or doctors needed her help in any way, whether it be inside or outside, Gail was always there.
Gail is the person that you'd want to be taking care of you or your family member, because she is going to pay attention to the little details that may say there's a change in the person, and she is going to be the detective that's going to get to the bottom of any problem and find the best solution. So she's really an advocate for her patients and for their families as well.
When I think of Gail, I think of really 2 words: compassionately driven. She's always in the moment and always truly what's in the best interest of people. And I think that's what makes her pretty special.